Let's talk to Iain Duncan Smith. He's a Tory MP. He's a former Work and Pension Secretary, indeed former Tory leader as well, as you will know. Good morning to you, Sir Iain.
Morning, Julia.
Announcement from the Prime Minister yesterday, message that, this could be lasting 6 months. Basically, look, if we don't all comply, we don't obey the rules, we're looking at a very tough winter. We're looking at tougher measures coming in ahead. What is the end game for this, as far as you understand it? Because previously the end game was defeating the virus. Well, we know we can't defeat viruses. The end game was also we were going to flatten the curve. We've done that. And we were going to protect the NHS. And we've done that. So what is the purpose of this?
Well, that is one of the big questions that sits across all of this. Is the purpose seems to shift quite a lot depending on which phase you're at. You're quite right. At the beginning of all of this, we were flattening the curve to be able to handle it in the summer, where there is less chance of other infections, etc. Then that became a save the NHS, and we built all these extra hospitals. But in fact, the NHS magnificently managed to cope. And then we were moving back to try and get the economy back together. And now we're looking to suppress, I think is the latest concept by the scientists, suppress this until they can come up with a vaccine. Now, my concern about that is to give the public a kind of false target of hope about a vaccine. There may never be a vaccine, and there may well be, but there may never be. In fact, there has been rarely vaccines that have succeeded against viruses. So we have to condition ourselves, I think, more in line with Carl Hennigan and the Oxford team, who I think are the most realistic group. And I think the Prime Minister's actions last night more mirror what they're saying than Sir Patrick Vallance. And what they say is that you've got to learn now to live with this virus. We may get a vaccine, in which case then we can certainly restrain it much more. But they're more in terms of where Sweden is in this, which is that you do all the sort of controls last night like we have, which is, sitting at tables in bars, not going beyond certain times in the evening and limit the numbers in houses. But other than that, saying that people can go to offices, children must go to school, all these things. Now, this is where we probably are now with these constraints. But the result of that has been for them, they had a second spike. That second spike was much shorter. It came down. There were no extra hospital admissions, and their death numbers were pretty well flat throughout. And so I think this is the key for us, because what we also have to do is to get the balance of risk right. Because right now, what we don't hear and what the public isn't told about is the number of people who are cancer patients who are not getting their treatments. Karol Sikora, the oncologist, said the other day he thinks a minimum of 10,000 extra deaths to those suffering from cancer because they're scared of going into hospitals. They're not sure about taking their treatment. You can extend that to dialysis, to people with heart problems. The rise in deaths in areas, because we've been so obsessed with only COVID, we have to get a balance here, which is we've got to still carry on the rest of our lives. And that's where I feel last night the Prime Minister didn't go off down the extremes that some people are advising him, but has actually stayed on what I think is the right process to make sure that life can still go on and we don't go back into a terrible lockdown, which did so much damage.
Except many people are concerned that we're not getting a proper cost-benefit analysis. It's something I'm going to ask the Foreign Secretary, Dominic Raab, about a little bit later in this hour, where in terms of the trade-off, and again, that 10,000 figure from Karol Sikora, we've seen other very reputable charities and medical groups and organisations give figures far higher than that, the people they believe have already, have already died as a result of heart disease and cancer and not being treated. And we know that now there's an awful lot of the people who may well have died in care homes over this period of COVID, vast number of them very elderly with very large numbers of underlying problems as well. But a lot of the reason why they all died was they didn't get healthcare because doctors were not going to visit them. They weren't allowed to be taken into hospital. So there is a massive cost here. And there's a massive cost from jobs losses as well. We've still got this ongoing thing, and you see this on social media all the time. When I point out things like, 99.9% of people aged under, I think if you're aged under 70 and if you haven't got any underlying health conditions, 99.9% of us will not die of coronavirus. And even at the worst case scenario, if you are in your 80s and you've got an underlying health risk, you are still looking at a sort of 96% will survive. Now, when you point that out, and there are only 307 people under the age of 60 in England in hospitals from February all the way to the 9th of September, healthy people have died. So you're looking at, very, very few people of a healthy disposition under a working age actually dying of the disease. When you look at those figures, that puts it into perspective. And yet there is this obsession with the daily death figures for COVID. And we don't see the daily death figures for cancer, for heart disease, for dementia, for obesity-related illnesses and the like, car accidents, suicide, everything else. Do you think that we have got this into perspective and we have got the balance right?
Well, I've looked at the global figures for this, and it's quite clear what COVID does and what it doesn't do. And you're right about this. The average age for death globally is 80 to 82. Less than 4% of those who have died with no known comorbidities. And I say no known because many of them may have had obesity problems, etc., elsewhere. So we know that essentially this is a virus which that triggers problems for those who have already existing serious life-threatening conditions. And that is a critical element. That means basically that the risk levels to those who don't are very slight indeed. What the government has been worried about is not that damages them. And for example, the risks of a person of under 40 are greater getting on a bicycle than they are getting COVID and dying. And yet we're encouraging all of those people to go on bicycles. So we manage our risk every day in our lives. And what's happened, I think, since COVID is we've sort of lost the balance of how we manage our risk, crossing the road, crossing without a zebra crossing, getting on a bicycle, riding a motorcycle, getting in a car, by the way. Has about the same risk as getting COVID for all those in the non-risk group in terms of their accidents. So getting that balance right, but understanding that if we get obsessed by this and focus only on COVID-19, then what you're saying is quite correct. And we've seen that, which is people get so scared, they won't go to hospitals. I've heard of stroke victims who are refusing to go to hospital for treatment, which is life-saving, because they're more fearful of getting COVID. And the problem is, therefore, get the messaging right about the balance of risks.
Yep.
Yes, we want to suppress, but learn to live with COVID and protect. The key that Carl Hennigan at Oxford is saying, and they're saying, is you must protect those who are vulnerable and then slow down the transmission for the rest. But the fact that as they build up herd immunity, then each spike becomes smaller and smaller.
Indeed.
And smaller.
I just want to add to this. You're pointing out, people are scared to go to hospital. It's not people are trying to get hospital appointments. People are getting in touch with me saying they've had given a hospital appointment for something quite urgent, months away. People are being told to wait 3 months to even see a consultant after going to the GP. So when they are actually going to seek medical health treatment, they are actually being refused it by our supposedly National Health Service, which has become a national COVID service. So again, can't blame people. It's the system, it's the government, it's the health chiefs that are making these decisions that are going to cost people's lives, and they know they're going to cost people's lives, and they're doing it anyway. And that's the bit I think a lot of us find it difficult to live with. 8:17 is the time. I have to say thank you very much to Sir Iain Duncan Smith for joining us.